alike. Tonight, we are so excited to welcome back truly a good friend of our Academy, Dr. Micah Sadigh, a Ph.D., who is going to speak on a topic that I hope you'll find very interesting. He's a professor of psychology at Cedar Crest College in Pennsylvania. He's a graduate of Moravian College and Lehigh University. He's a diplomate in Franklinian psychology and existential analysis. He's also a fellow of the International College of Psychosomatic Medicine. Dr. Sadigh was a recipient of the Cedar Crest College Faculty Award for Excellence in Teaching in 2009. He's the author of 5 books, including an internationally recognized book on the treatment of chronic pain and stress-related disorders. Tonight, it is a huge honor and privilege to welcome back a friend who's going to speak to us tonight on burnout in dentistry, early detection, prevention, and treatment. Without any further ado, Dr. Sadigh, welcome back to Canada. The floor is yours.
Thank you so much, President Rawson. It's a pleasure to be back with you and with our dear friends and all the people who are wonderful people who are joining us tonight. It was 2018, actually, that I had the privilege of presenting to the Academy in Toronto, and you gave me this beautiful clock, which I still have, and it works beautifully from that meeting. And I was back in 2019, and since then we've had a few opportunities for some of these virtual meetings on various topics. So tonight's presentation is something that I actually have been presenting on for a number of years. Started with a group of physicians, actually, when I was invited to give this talk. And then gradually, from time to time, dentists asked me, doctors in dentistry, asked me to give a presentation on this topic. In fact, just I think a little over a month ago, I was in Ottawa, the Ottawa Dentistry Conference, where I presented a version of this talk. But this is going to be an expanded and more comprehensive view of what burnout is in dentistry and why it's so extremely important to be aware of its devastating effects. So this is part 1 of a 2-part set of lectures on burnout. So sometime in the future, I will be back to deliver part 2. I do have a request at the beginning of this talk, and I hope you will honor my request. And my request is that if you know of professors in dental schools, where you went to school, if you are a professor doing adjunct work or full professor work, please start talking about the importance of early detection of burnout and looking for those early signs, which, by the way, they begin in dental school. So unlike students that let's go to medical school or nursing school, other healthcare professions, we actually begin to see signs of burnout actually in students in dental schools. There is a huge body of literature covering this area. I'll highlight a few of these studies for you tonight. But we know a lot more about burnout in medical practice, in surgery, in nursing, internal medicine, etc., which is just wonderful that we have so much research in those professions, but it's incredibly tragic that there's not enough research done on the topic of burnout in dentistry, where it has had devastating effects on doctors, and sometimes it's resulted in suicide, sometimes it's resulted in them resigning and leaving their practice altogether. So we need to really start thinking about what are the reasons that there's not enough research in this area, even though we see what's happening, what's the outcome of this devastating condition. And I really should start in medical school, and there's a lot we can do to prevent it. Well, recognize early signs, prevent it, and also treat it. What's tragic about burnout is that it has a destructive effect on a person's personality. And our personality has a great deal to do with our identity. And when the personality begins to erode, our identity begins to fall apart, the way we interact with others is going to change, oftentimes in a very negative way. And also we lose who we are. So this is probably the most tragic thing that can happen to a person, to a good professional, a good doctor, after years of practice and education. It's absolutely devastating. And sad to say, I'm sorry, I mentioned it now twice, it can lead, it can bring someone to, at one point, end his or her life. So that is as alarming as this is. Boethius, great Roman writer, is close to being executed when Lady Philosophy shows up, and one of the greatest books ever written, called Consolation of Philosophy, at the beginning of which Lady Philosophy says to Boethius, "You have suffered much because you have forgotten what you are," and that has to do with you have lost a sense of your identity. You need to get it back. Identity contains anxiety. Identity is what we need to help us chart our course in life, where we need to go, what we need to accomplish. And when identity begins to fall apart, our sense of reality begins to fall apart. So we need to get that identity back. And what does it mean to be a dentist? I assure you, it's much more profound than that simple. Well, you're working with teeth and alignments and gums, and even helping people with sleep disorders, etc. There's much more to this, much more. In fact, it's a discipline that has more to do with psychology than any other discipline that I know of. And I've talked about it in previous presentations, and I can come back to that later. Burnout is a real phenomenon. I'm sad to say, generally speaking, people misuse the term. At the end of the long day, somebody says, "I'm burned out," and they go home, drink a glass of wine or have some food. Next day, they're back. And so it wasn't burned out, that they were burned out. They were just tired. So burnout is a real phenomenon. It has a number of manifestations that we'll discuss tonight. And it's a developmental process. It gradually grows. It's a very slow, insidious process. The good news is that when people recover from burnout, many people actually become more creative. It's almost like they have rediscovered themselves. And an important point, they're more protective of who they are. So there's a sense of self, rediscovery of self, and also protecting oneself. And one aspect of recovery from burnout, which you may come across this term, creative illness, is that when people recover from it, they become highly creative. They rearrange things in their lives. Yes, they may leave their practice, but they come up with new ways of coping with the stressors in life. And yes, it's true, as you will see, some people leave their practice for good and have nothing to do with their profession. I'm going to just talk about a couple of studies that I will gladly provide you with copies of these studies. This is by no means an extensive collection of studies, but I've been very picky in terms of choosing which studies I think you should maybe look at to just get a little more knowledge about this phenomenon. So this is a wonderful study, very good introduction to burnout and its effect upon anxiety and depression among dentists. It was published in 2004. It's a brief article, very practical, very helpful. The only problem I have with these articles, and I'm going to repeat this a couple of times, is that they give you just some general ideas about how to prevent burnout or how to reverse it, etc. And I think that's what's lacking in these studies. They're not. That's part of these studies is not very strong. Just well, pretty much good luck, and you can do this A, B, C, D, etc. So we need to take this much more seriously. And this will be some of the examples about stress management techniques and techniques that you can use in dental school. I would redefine stress, and I think if I were to redefine stress, I will get people's attention that stress is a devastating phenomenon that depletes our resources. So if and stress is a part of life, but when it depletes our resources, that's when we become symptomatic in a variety of ways. We need something more substantial to guide us in terms of what we can do about burnout. This study by Singh, I highly recommend reading this study. They basically looked at a series of studies, 115 studies that had to do with burnout in dentistry. And the study actually comes to an end with this very frightening statement. If untreated, burnout could have disastrous long-term effects such as depression and suicide. And again, we need to pay close attention to that, what these devastating things are. Depression is an aspect, to me, is an aspect of being human. From time to time, we feel depressed. However, when depression reaches a point where we no longer see a possible future, when life becomes so gloomy, so difficult to navigate, then there are certain options. One is to numb oneself, one is to destroy oneself. So how can we treat this properly? So those are not the options at the end. This Nangle study, it's an incredibly useful paper where they look at social cognition, emotion regulation, and how people cope basically in socially from day to day when burnout is present. This is a part of the study in which, as you can see, there's a positive correlation between burnout and difficulties in emotional regulation. So as burnout intensifies, please pay close attention to this point. People have difficulty regulating their emotions. I'm losing my ability to control my emotions. I get sad and I cannot come out of it. All of a sudden, I'm responding to people in certain ways that I shouldn't, but I can't stop it. When I'm upset, I believe that there's nothing I can do to make myself feel better. That sense of helplessness is what fuels depression, basically. I don't know, emotions take over and I can't control it. Now, this is, I'm going to explain this. I'm going to explain the physiology of these. These articles do not. They just say these are the types of symptoms you have. I'm going to actually explain this to you in some detail why such thing happens. The Kapoor paper on burnout in dentistry, an overview is, again, another very, very good paper. And one of the graphs, one of the tables in this article, which we'll talk about some aspects of it, is so filled with text, all these words over there. And once you get the paper or when you look at these slides, you can, by the way, you will have my PDF of my slides. But if you were to look at this table, you see all of these terms that may be familiar to you. So, oh yeah, I have this, that, etc. If you don't mind, I'm just going to highlight just a few of these terms for you. One is powerlessness, and feeling that one is not in control of one's environment. There's a sense of powerlessness and feeling trapped that you can't escape this situation. One is to withdraw basically when such thing happens. The other one is, and I will take this very seriously, especially if you're in a practice with other doctors working with you. This is, or other professionals working with you. This is an unfortunate aspect of burnout and you will see why this happens in just a minute, that we begin to see distrust in others. There's a level of hypervigilance and also the sense that people don't understand what I'm going through, etc. Are they going to harm me? So that's actually, we don't want to talk about these things. No, that's not the case, but we feel these things. And that's why it's important to actually address them. Abandonment of recreational activities. Every doctor that I've worked, whether they're medical doctors, dentists, that's basically medical doctors included, they would absolutely agree with me that at one point they stopped doing those fun things. And right here, so I'm going to use this if the talk were to stop at this point, which is not going to stop, I would say empower people, give them back a sense of power over their environment. Find out why there is lack of trust. Lack of trust is something that needs to be communicated and needs to be resolved. And also to return to those recreational activities. They're literally recreational activities. They may take an hour here and there, maybe if not every night, it should be every night, but if not every night, maybe a couple of times a week. Doing things that you're not looking for an outcome, specific outcome, in which you feel you're free and you're creating, having fun, and you can put it away and do something else. Please try to recover this. I often give assignments to doctors that I want you to go back to some of those things. I used to do those things years ago. I no longer do them. So get back. And they're so happy when they go back to taking pictures, collecting pictures, playing music, whatever those activities are. So please keep these in mind. This is by the way, that was a 2019 study. Then this is a 2017 study in which they developed a little package for dentists to use as a way of reducing stress, building resilience, etc. I have a lovely, lovely paper, very nicely done, Chapman paper. And they have these various exercises and suggest the purpose of these exercises, etc. So take a look at this. Again, I'm going to highlight all the kinds of things you can do, and I'll cover treatment a little later. But take a look at this closely. And I would say if I were to highlight one item, that would be the writing part. Please do the other ones as well. After a while, when this person is approaching burnout or in the midst of burnout, it becomes very difficult to communicate feelings. And this is truly unfortunate. It's like, I don't know how to say, get a piece of paper, do not text, get a piece of paper and write those feelings down on a piece of paper. And if you'd like to read a book that has actually explored good, solid research on what happens when people express their emotions or attempt to express their emotions by writing them down, that book is called Opening Up by James Pennebaker. It's replete with studies on the use of writing and journaling, etc. and what it does. You don't want to journal for hours. It's usually about a few minutes to 20 minutes maximum, unless you want to write a book, then you go longer. But actually, research shows it's not a good idea to journal more than 20 minutes. You get, at one point, it has a reverse effect. And it's used for emotional regulation, being able to express one's feeling and emotions. But there are other things. These are good papers, helpful perhaps. but I want to give you even more tools, particularly when we get to that next talk next time, because I have a whole different way of looking at it. So let's look for definitions of burnout. First of all, let's see who's more likely to burn out. And this is helpful. This gives us a sense of what this phenomenon is. I'll repeat this a couple of times, but you cannot burn out if you're not conscientious. So burnout is a phenomenon that occurs when people are highly conscientious and caring individuals. Of course, you went into your field to work with people, to care about them and help them and reduce pain. Of course, you're conscientious. Therefore, your field is extremely vulnerable. Doctors in your field are extremely vulnerable when it comes to who don't know how to say no. I hope you're doing some self-reflection at this point. Okay, we'll see one more patient, squeeze them in during my lunch. Yeah, we can do a little evaluations and a quick treatment. Okay, it was not so quick. Now I'm late for my next patients, etc. Who don't know how to say no, who are hard on themselves. I have enough I know enough wonderful dentists, dear friends, who tell me about what it was like to go through dental school, how hard they had to work, and they learned to be hard on themselves. And there's one word I wish I could delete it from your vocabulary. We'll talk about that a little later. And this next item is what you need to be become aware of. And sometimes when people burn out and come back, they recognize this. It's almost like if you've forgotten how to look at your fuel gauge, unaware of their limitations, that unaware that they are on empty and they keep pushing themselves. Oh, I can do that. I'll catch up this weekend with some rest, etc. And in time, people who feel that they're being taken for granted, they're just there like a mechanic and fix things. And oh, thank you. You may not even hear that was there to, I feel much better, and they walk out. So that's an unfortunate. So if you don't mind, not this moment, if you don't mind, write down maybe a word or two. What else? What else would you add? We talked about not being able to say no, being conscientious, not knowing your limitations. What else? I'm just going to make a suggestion if you want to use this. Do not have enough emotional support. Have support, lovely spouse, lovely significant other, lovely friends, mailman, whoever is in your life. But emotional sharing, emotional support is very different than being around people and talking to them. I see a question in the chat, so if you don't mind, I'm not going to open it, so I'm going to continue. But if Bianca, if you could read that and let me know, I will gladly answer all your questions. So please feel free to post them.
Carry on, Micah. Don't worry about the chat box.
Okay, great. Thank you. I just want to make you feel good that I'm paying attention to what's happening in that.
Don't worry, I'm a control freak. You keep on talking.
Thank you so much. Just relax. I'll try to ignore it. So the term burnout, believe it or not, the first time that it was actually introduced in literature, it actually showed up in literature, not something in a dictionary, was 1975, and if I recall, a psychiatric resident who was visiting here in the U.S. By name of Herbert Freudenberger actually uses the term burnout in the healthcare professions. So, and then later, Malzak and a whole slew of researchers started using that term and finding ways of measuring it. So, as far as I know, this is one of the oldest studies looking at burnout in dentistry. So, this was published by Forrest in 1978. And I'm just going to summarize some of the key points of the study. And if you like my papers, they're highlighted. If you like for some extra contribution, I'll give you the highlighted version. You don't have to read the whole thing. Confinement, being confined, patient anxiety, perceiving patient anxiety. And as you will see in just a few minutes, this is what these talks usually don't delve into. I'm going to show you the physiology, why you become sensitive to your patient's anxiety. Stress of perfection. I think that's synonymous with dental school or dentistry. And economic pressures are some of the contributors to burnout. As I mentioned earlier, it is not an on and off switch, it's developmental. And as I go through the different set of symptoms that show up, it's so easy to miss the evolution of these symptoms. So the sooner you catch them, which is why I'm doing this tonight, the sooner you catch these symptoms, the better, because we can jump in and so early detection is important so we can reverse them. Some have suggested, especially in the workplace, that's why you see a lot of industrial psychology, organizational psychology research, that it comes out of unremitting interpersonal stress. That's a common way of viewing burnout. I respectfully disagree. That is unbelievably narrow. It's a very narrow way of, yes, interpersonal stress plays a role, but I assure you there's a much bigger picture at work. So when we look at research on burnout, so I'd like you to remember these three. So these are basically the three aspects of burnout. Study after study goes out, people look at these three. Where is the person as far as emotional exhaustion is concerned? Diminished personal accomplishment, depersonalization. So look for studies where they say we're going to measure burnout, and we're going to look at, because there are instruments now, the Melzack burnout instrument, commonly used, and there are various versions of it used as well. So emotional exhaustion, at one point I'm becoming numb, or I don't feel anything anymore, and it seems like I don't even care. I'm kind of a robot that does these things. A surgeon said to me, this is a respected surgeon, very much like a father figure to me, actually. I did research with an orthopedic surgeon. She said to me at one point, he said, I can pretty much I don't think he ever tried it, do a hip replacement with my eyes closed. I am a mechanic, which is devastating to hear. It was devastating. Long conversation regarding diminished personal accomplishment. What I'm doing is not important. Anyone can do this. Big deal. So there was a time when it was very exciting, and look at the work you did, and after a while, it's so you don't give yourself any credit. And then of these three, they're all extremely important, but the frightening part of these three is when the person actually disconnects from him or herself and becomes more or less robotic, and views him or herself as a mechanical being, non-human. But the sad thing is eventually the patient may be viewed in that way as well, that you're just set of teeth or set of bones in his case, set of bones and tissues. You just put a new replacement there and sew it up, etc. Dehumanization begins to take place, which is again very devastating, especially for someone who cares so. Let's take a look at some of the physiological perspective on what happens when we burn out or when we suffer from stress-related disorders. So Hans Selye was an endocrinologist, an Austrian endocrinologist, basically brought the term stress and, to the field of medicine, to physiology, basically. We had a sense of, stress is more of an engineering term, but the father of stress research is Hans Selye. And Hans Selye I hope this will make you feel good. Hans Selye um, moved to Canada, your beautiful country, and I love your country and the beautiful people that whom I have met during these trips. And he taught at McGill and did incredible research on stress and changed the way we look at stress. So this is one of the earlier ways that Selye conceptualized stress and basically suggested that let's say right now, if I'm sitting back and I'm just enjoying myself and no demands are placed on me, if at one point somebody says stand up or pay attention to this, or something got disconnected, or somebody's crying, etc., etc., there's a brief shock period, a brief that a person freezes. We know that where that happens in the brain, followed by release of these powerful hormones, catecholamines, and in time glucocorticoids, to respond to the stressor. So, and at one point you begin to adapt or resist these changes, your heart rate being up, blood pressure, you begin to become less aware of those symptoms and cope with it. And if you were to maintain that level of coping, eventually you run out of your coping resources and go into an exhaustion phase. Hopefully, you're alarmed, you go into the resistance phase, and then the stressor is removed, and you go in, instead of exhaustion, you go into a relaxation phase. So during that shock alarm phase, the counter shock phase, there's we see symptoms. People are aware that their heart rate is faster, they're perspiring, perhaps they're a little difficulty focusing, and then their focus becomes extremely narrow. So there are a set of symptoms. It's during the resistance phase when you have mobilized all these resources in your bloodstream, and your body is giving you lots of sugar to manage the stressor, and constricting your blood vessels in your lower extremity so you can have ample amounts of blood into your brain, muscles, etc. So all these corrections are taking place. So you're resisting the stressor. However, the sad news is that some people think that resistance is actually a normal state. Hey, I'm handling it. Yeah, I saw an extra patient. I had a panic attack an hour ago when I had to see an extra. But you know what? I did fine. In fact, I can incorporate a pizza party later in the day. I can handle it. This coping is limited to your resources. You're going to run out of it. So unless you replenish your resources, you're going to run out and go into that exhaustion phase, during which symptoms will return. Now, I'd like to introduce you to the concept of stress using this because it's meaningful. We can measure aspects of it. But the reason Dr. Selye, wonderful Canadian, naturalized, of course, Dr. Selye did not receive the Nobel Prize for which he was nominated was because he did not include one minor but extremely important concept in his viewpoint, which has to do with perception. So that the entire cycle may never occur. There may be a stressor to which you may not even respond. It's a stressor, but you may not, because you perceive it as not important or not that important, or I can handle that, big deal. So the event is being cognitively processed. The reason I'm being emphatic about this, that's what we need to change. That's what we need to change. And we can't change perception. What are you saying to yourself? Oh my God, it's over, it's finished, no way, I'll never recover. That's when the stressor will have a profound, devastating effect on your physiology. However, if we could change the perception, I have been here before, I can handle it, I have support, there are other people, maybe I can reach out to so-and-so, etc. Changing of perception will change the stress response. So please write it down. What are you saying to yourself? What are your thoughts? Um, we can change those. We can modify them. But the best way to modify it is to actually talk about it. Franz Kafka, one of my favorite writers, um, captures. He was a genius. Most people discovered him long after he was gone, sadly. He writes. He suffered. If you look at his uh, biography, he was definitely suffering from burnout. Impossible to sleep, and that's exactly what will happen if your sleep is affected. Impossible to stay awake. Possible to endure life, or more exactly, the course of life. All the things I have to anticipate. And it ends with this profound message here. So the italics are mine. The inner and outer clocks are not in unison. I'm out of phase with life, with daylight, nightlight, whatever. I'm completely out of phase with life. And I don't know how to cope. So someone who has completely depleted their resources. A few years ago, maybe about 8, 9 years ago, I was at a holiday party, and I recall I'm standing there. It was a pretty happy, uh, energetic, I should say, party. A lot of people were there talking, and a couple of people were asking me about. I did my postdoc work on pain, actually, uh, pain research. So a lot of people were talking about, how about this pain, that pain, etc. And as I was making comments and making some suggestions, there was this gentleman sitting on a couch over there. I can see him even today, very casually dressed. Everybody else was, slightly dressed up, but this guy was casually dressed in his jeans with big belt buckle, um, very very casual, and a long beard. And every once in a while, he was listening to us. He was drinking his beer, and every once in a while, he'll make a comment like, "Yeah, you can add this medication to it, and yeah, you should really do this as well, etc." So I approached him and said, "Oh my goodness, my name is Micah. What's your name?" And we introduced ourselves, and I said, "What do you do?" And he said, "I'm a farmer." And I said, "Wow, for a farmer, you know a lot about pain management." He kind of giggled a little bit and drank a little more. And he goes, "I used to be an anesthesiologist," which I was like, "You just told me you were a farmer." He goes, "I am now. I gave it up. I burned out," his word. And to make the long story short, he invited me to his, it's a lovely, lovely person. He invited me to his farm, which is not too far from where I am in Allentown. Uh, nice farm. I went there, and yes, this was a doctor who's now a farmer, and they had all kinds of animals over there. And at one point, we walked into this big barn, and he, um, behind the door to this barn, we went to pick up a shovel or something, but maybe he was trying to show me something. He pulled it open, and right behind it, there were his diplomas on the wall. It's devastating. Wonderful anesthesiologist. It was so well regarded, but not enough that people did not recognize that a wonderful doctor was being destroyed. And he has nothing to do with medicine. And we've lost a wonderful anesthesiologist. So burnout has physical, interpersonal, psychological manifestations. And the more you feel helpless, and please remember, with regard to your work situation, home situation, combination of work and home, yes, burnout is not something you turn it off at work and go home and enjoy yourself with your significant other and watch Netflix. No, it'll go home with you. And as you recall, conscientiousness has a profound impact. Am I saying to you that don't be conscientious? Absolutely the opposite. We need conscientiousness in our world today. This more than ever. However, conscientious people need to be protected. And the sooner you realize that conscientious people are oftentimes taken advantage of, and they don't know how to really stop and take care of themselves. That's one of the greatest keys that we should keep in mind. Potential causes of, I'm giving you some key points that show up in various studies: excessive workload, loss of autonomy, um, administrative burdens, etc. To me, is a decline in the sense of meaning. So that next talk um, will be about how to get meaning back, um, and not being able to integrate one's personal and professional life. So message one was there's a tragedy that wrote our personality, and the second one is symptoms are messengers. I don't know about your beautiful country, but here we have so many drugstores, we have so many CVSs all around us. I can pretty much go and get anything. A headache, there's a pill over the counter, I can pick it up. If I have stomach problems, if I have back pain, etc., everything you can imagine pretty much is it's out there. So we cover up our symptoms. Um, Covering up our symptoms does not mean we are answering what the message is. The message is something bad is happening, and covering up symptoms is a huge mistake. So, if you don't mind, I'm just going to go a little bit into the physiology of explaining how this whole thing works. Oftentimes we hear about the amygdala, which is the brain's warning mechanism. Something's going on in the environment. But an extension of the amygdala is this structure, which is oftentimes not fully recognized, how important this is. And it's really sad. Most people don't even know where it is or how it works. I'm going to delve into it. This area under excessive stress is going to expand, actually do a lot more. And if it's heightened, if it's alarmed, it's picking up too much information, it's going to send down this signal that you're in stress, danger, 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 and you're going to deplete yourself. So BNST, the base nucleus of stria terminalis. Sometimes you may actually see BST. Sometimes they drop the nucleus. Is a structure that has its own kind of immersed in various neurotransmitters as transporters, and it basically tells us there's danger out there and watch out. And, so long-term stress, excessive stress, long-term stress activates this, and it's very difficult to just turn it off. As you will see in just a moment, it actually grows, it actually develops more dendrites and becomes more convoluted and starts giving more and more signals to us that something is wrong, something's going on, and that's going to affect our perception. That is where it's located, right? Anterior to the amygdala, and oftentimes you don't hear about it. Please look up some good research on this. This is really, for us human beings, this is where a lot of our stress and anxiety, particularly social anxiety, this is where it's concentrated. So thoughts and emotions, etc., going up and down through this circuit over here, and then activating glucocorticoids. I'm sorry, please bear with me. This is, I assure you, it may look complicated, but just stay with me. I know how to explain these things. Stay with me. I'm just going to highlight a couple of points. So to the left of this picture, you will see the normal activity of right side of the brain, left side, specifically prefrontal cortex. They talk to each other. You see that arrow, the right and left hemispheres talk to each other, communicate with each other, help each other out. Although sometimes we see a dominance here and there, but they're talking to each other most of the time. And then you see their connection to the hippocampus, our memory system. And then the BNST, just mentioned to you that bed nucleus of stria terminalis, which is responsible for the stress response. So it's a normal activity. I recognize some stressor. And then we are activating all these organs. This sympathetic nervous system is activated. It looks like an eye if you look down. Sympathetic nervous system is activated. Parasympathetic nervous system is there. just in case to help us recover. And then we produce glucocorticoids, giving us energy, suppress the immune system if it's necessary. So we may experience anxiety. What is this? What's that? And come up with ways of coping with it. So think of coping, but adaptively coping. Now, let me shift you, come over here to this side. And please note what's happening to the prefrontal cortex. As you can see, it actually has atrophy. It's like smaller. And the link between the two, as they were talking to each other, is disappearing. And this is frightening because you can perceive things. And your left hemisphere is not there to tell you, why are you making such a big deal out of it? What's going on? No, you're misperceiving. That part of your brain is actually not as active. So you're perceiving this danger with no voice inside of you to calm you down, etc. As you can see, if you look down, you'll see the hippocampus. Doctors, please pay attention to this. Hippocampus is shrinking. It's actually getting smaller. This is where we see chronic stress will have a devastating effect on memory. So this is where we want to change things. We can jump in. And then the entire structure of the PNST is actually enlarged, which means the slightest source of stress is going to be exaggerated, magnifying glass. The parasympathetic nervous system is getting smaller, which means more sympathetic activity, means more catecholamine, higher blood pressure, etc. Glucocorticoids are much more available, and which is not a good thing. And now there's not only anxiety, but also a depressive state. And the person becomes less flexible. I used to be able to just go from one thing to the other. How come I can't? So erroneous interpretations because of that, the two hemispheres not talking to each other, and excessive hypervigilance, particularly when something is ambiguous. Your coworker, your office staff, your hygienist, somebody walks by you and they usually smile, and today their facial expression is slightly different. What's wrong here? What's she gonna leave? Is he gonna leave? Is he upset with me? It's not interpreting the slightest thing is going to be perceived as a source of threat. So the inability to get those things talk to each other. So pause here. If I were to stop right here, what can you do about these? I will get you to confront your distortions about the fact that somebody didn't talk to you or they didn't return the call. It's why are you jumping to those devastating conclusions? So that would be one. Another thing, I mean, you may think this is funny. It's not. There's a ton of research. Music actually allows to rebuild the communication between the two hemispheres. That should be a part of your recreation. You have some wonderful musicians there in Canada. So these are stages of burnout. We talked about aspects of burnout. Stages of burnout would be higher arousal. And higher arousal, and you're trying to cope eventually. And then the next thing is you're depleted. And I'm asking you to please, this is where I want you to be compassionate toward yourself, your colleagues, and others. When people are burning out, they make huge mistakes, professional mistakes, personal mistakes. So I said to you, symptoms are message. So what's the message of making these mistakes where you look back and say, what was I thinking? I'll tell you what that message is. Sometimes the only way to get out is to make a mistake, to reach out to others and say this simple message, help me. Help me. And there's no one there to listen because you're strong, you're so powerful, and you've been able to solve all the problems, et cetera, et cetera. Yes, but you're a human being. So that's what those mistakes are about, help me. So let's look at the chronic, the arousal phase of it. It's persistent irritability. Everything's getting on my nerve. Anxiety, thinking about the future. Periods of high blood pressure, and you and your physician, your nurse may ignore these. It kind of goes up and down. Forget it. that should be alarming. Bruxism, you know everything about it. Oftentimes internalizing emotions, it expresses itself through bruxism. And believe me, there's a ton of um, theories and research on the emotional conflicts and how it can manifest itself in one organ we use to learn to use almost immediately after birth. Insomnia, both well, insomnia in terms of difficulty falling asleep, maintaining sleep, and when was the last time you woke up and felt refreshed? Forgetfulness, I showed you how the amygdala begins to not the amygdala, the hippocampus begins to get small. Heart palpitation, strange heart rhythm. You have an EKG, no big deal. These are all signals that you are pushing yourself too hard. Headaches, etc. We see an elevation in glucocorticoids. Just shows you when in that previous slide, PNST, I showed you that under stress, we gradually begin to produce too much cortisol with glucocorticoids, which means if glucocorticoids are high, we cannot do repair. Growth hormone begins to drop, especially when you're not getting sleep. This is one of my favorite slides. You know, I put it up all the time because I did research on cortisol and shifting cortisol, especially when people are depressed. So you cannot do repair and produce cortisol at the same time. One needs to be turned off while the other one works. So expect aches and pains in joints, etc. The second phase of burnout is now I'm beginning to realize that I don't have enough energy. So if I show up late for work, or show up just on time, then I don't have to socialize. I don't have to tell you what my weekend was. So we begin to find ways of conserving energy. I'll do it tomorrow. I wish I had extra days. Sexual desire, what's that? That requires too much energy. Forget that. Moving on. But that may be a way of bonding. That may be a way of connecting with loved ones. But nope, that has to go. Persistent tiredness in the morning because sleep was not refreshing. Perhaps doing your notes late, etc. Social withdrawal. Remember, socializing, which is so extremely important, requires energy. I can't smile. Cynical attitude, constantly seeing bad things, wrong things. Good morning, what's good about it? Wow, where did that come from? Cynical attitude, which is so sad. Lovely doctor's person who suddenly is becoming cynical. Being resentful, somebody's doing better than me. Somebody has more hours. Somebody has nicer patients or fewer patients, or they're only doing this kind of work, whereas I'm doing. So it becomes necessary to numb oneself. Alcohol use followed by use of stimulants. Alcohol is a wonderful thing if you use it properly. A glass of wine is wonderful, but if that's the only way I can unwind, that's a sad. Look for I don't care. To me, that's when you start hearing them. That's another source of alarm. Sadness, which just I'm not happy about anything. And depression as being a sense of depletion. Suddenly there are stomach and bowel problems. Please, the digestive system, when it starts giving you symptoms, means there's too much sympathetic activity. Mental fatigue, it's not COVID, just I'm in this fog, I can't pull myself out of it. Physical fatigue. Headaches that were sporadic here and there now becoming chronic. Let's take more Advil. I want to drop out. And that's so sad because people begin to withdraw. Don't say hi to anyone because I don't want to get involved in a conversation. Let's do everything on Zoom, which is fine, but everything on Zoom so I don't have to be. You can't even see me. End one's life. So what's the use? That means the person is getting very close to doing something harmful to themselves. Once a person has reached that last stage, yes, we can reverse it, but we need help. We need help. And I'm going to highly recommend, this is the time when you need to consider antidepressants, which will be extremely helpful if somebody has reached that state. They have depleted some by neurotransmitters in the brain. We need to build that up. We need talk therapy. We need some way of getting people to talk about what's happening to their dream of what they wanted to do, where it's gone, etc. So psychotherapy, group therapy can make a huge difference. So this is how you reverse it. And these are not just interesting ideas. These are concepts that have good support for you. First of all, we've learned that people who burn out tend to forget when to eat, how to eat, what to eat, etc. They look for quick meals that give them a ton of energy, possibly a lot of carbs, which have a calming effect on them, etc. Improving quality of sleep will be extremely important, and using antihistamines is not the way to go, such as Tylenol, PM. Expressing emotions through psychotherapy becomes extremely important. Group therapy sometimes helps. I won't do group therapy with my colleagues or associates. You want to be in a place where you can be yourself and express yourself, and you don't want to go back next week and come across colleagues who listen to you talk. I would make sure that the group therapy is as safe as possible, as confidential as possible. But being able to talk things out is extremely recreational activity of finding ways of replenishing your resources, and rediscovery of role models. In the next talk, I will be talking about this, how important it is to have role models in life. At one point, you were inspired by people, an author, another doctor, a mentor, professor, someone, rediscovering them, and their teaching becomes extremely important. So one of our great writers and philosophers, the voyage of the best ship, is this exact line of 100 tacts. Allow me to translate this for you. Reinvent your practice. One way of recovering from burnout is do things differently, reinvent things, add new things to your practice, remove certain stuff, rearrange the room, rearrange the way you do your practice. Have rooms with different setting. Dr. John Vignana, one time when I was in Toronto, a bunch of us actually went to his office and how he had redecorated everything. And it was beautiful how that set it up in a whole different way. Reinvent your practice, add new things to it, modify things, etc. So we need to change your perception of what is going on with your practice in your practice. That we can address. You can't. You're too close to it. You need to talk it out to a good friend, colleague, etc. In terms of what those perceptions are, and sometimes attending talks such as this, going to conferences, hearing each other, not as a group therapy thing. That's not what I'm talking about. But sharing your perception of things and learning about how to navigate difficulty. Remember, people who recover from burnout gain a greater sense of self, and they're more protective of themselves. So recommit yourself. If you're going to give to others, you need to have a self. So the self cannot get damaged. So replenishing the self. Shifting from the world controls me to I am in control of my perception. And really viewing these challenges as ways of growing and adjusting. So a hardy personality is someone who basically sees challenges as a new way of coping with life. My final message for this talk, I hope I did not go over time. I think I did. I apologize. The first duty of love is to listen. Listen to yourself. So that's the beginning, to listen to yourself. So when you say to someone, I love you, the key is, are you listening to that person? Are you listening to yourself? If you have a colleague, a friend, significant other who is burning out, one of the best things you can do for that person is to listen to them. Not hear what they're saying, but really listen when they're talking about their emotions. First duty of love is to listen. That is, to me, is quite profound. That was what Paul Tillich. So to be continued, we will do a part 2 whenever you want me back, and we'll add a new dimension to the entire process. So this is my email address at the end. If you need to reach out to me, and if you don't mind, sometimes your email, sometimes I've experienced this. It's not at our college. If it's not recognized, it goes to the spam box, etc. If you don't hear, but please try again, and you can call me, and I'll be happy to even give you my cell number. Just say I send you stuff. Most of the time I get it, but we have all these filters because colleges are often under attack. So please email me. You will get my slides, and I look forward to talking to you. And thank you, Mr. President. I'm going to be quiet now.